being here. Mr. Kennedy, you mentioned that you were able to get 100,000 usernames from a website, but you did not mention which site that was. Was this the Healthcare.com?
It's part of the same infrastructure. Without
Oh, excuse me. Was it a part of the Healthcare.com?
Yes.
So you were able to get that information from Healthcare.com?
It's from the infrastructure from Healthcare.gov. It's from, if you look at what makes up Healthcare.gov, if you go to www.healthcare.gov, that's one site and server. But what makes up Healthcare.gov is chat.healthcare.gov, finder.healthcare.gov, data.healthcare.gov. There's multiple things that feed information into the main website. So you have all of these different working parts that feed into what makes up Healthcare.gov and that entire infrastructure, and that's what we found the exposure on.
Healthcare.gov.
On the infrastructure, on one of the sub-sites for Healthcare.gov.
But not the site of Healthcare.gov.
That is correct.
Thank you. Dr. Rubin, before I mentioned earlier, before I came to Congress, I was a nurse. In fact, I graduated from St. Mary's at the University of Notre Dame over 50 years ago, and my master's from SMU over 30 years ago. I went there because there was no school of first class in Texas that I could attend in nursing at that time. So that tells you how old I am, which I'm very proud of. But Dr. Rubin, what is your impression of the security in the healthcare industry? I have worked in the healthcare industry, and I have not found anybody seeking healthcare information to make a profit. Most of the time, it is some scheme for people seeking information that they want to do that. In the Affordable Care Act, the pre-existing conditions is no longer a factor. And so while I'm not trying to make a judgment on the information, I'm trying to understand why is there such an outcry at this point when medical records have been so available in any institution that I've worked in. Anyone who has any kind of hospital identification, whether it's the janitor or the nutritionist, a physician, nurse, can access a patient's chart that has everything on there that's going to happen or is happening to that patient while they're in the hospital. And that's something I know from personal experience. So I'm trying to understand, is the healthcare industry lagging in these security measures, or what is it about this non-security in the past is going to impact where we are now?
So to answer your question about where the healthcare industry stands with respect to security, I've done consulting in many different vertical industries, financial, all commercial, and in the last few years I've been working in the healthcare industry doing tours of hospitals and doctors' offices to assess their security. And I found it's actually perhaps the most far behind in terms of the security at hospitals, even things in the emergency room that surprised me, in the operating room, I mean. And so to your question, I think that the healthcare IT industry needs to learn a lot from some of the other industries in order to bring its security up to par.
Thank you. Thank you, Mr. Chairman.